Yeah, a lot of really good questions coming in again today. So let's get to some of them for you. First things first, what are the symptoms? Well, COVID-19 is pretty similar to the flu or common cold. That means a dry cough, fever, and shortness of breath. And the CDC says those symptoms might appear in as few as 2 days or as long as 14 days after exposure. All right, next question. How is COVID-19 spread? Can I get it from a surface? Well, it is believed to be spread person to person, mainly between people who are in close contact. That's within about 6 feet of each other. The CDC says it might be possible for the virus to spread by touching a surface or object with the virus, but it's not thought to be the main method of transmission. It is important to note here that there's still a lot health officials are learning about the virus. It was just discovered a few months ago, and more research is needed to determine a pattern of how COVID-19 is spread. Here's what infectious disease specialist Dr. Christopher Serino with Adventist Health had to say.
With the some of this recent information about the fact that the virus can potentially be infectious still after several days, it does kind of raise some questions, but I don't think you need to rub every surface.
Good advice there. And how can I protect myself and my family? This is a really important question that we're seeing. Because there's no vaccine for COVID-19 right now, your best defense is prevention. That means washing your hands often and do it for at least 20 seconds with warm soapy water. If you don't have soap, use a hand sanitizer with at least 60% alcohol and avoid close contact with people who are sick. You're going to also want to avoid touching your eyes, nose, and mouth. Cover that cough or sneeze with a tissue and clean and disinfect frequently touched objects and surfaces using those regular household cleaning sprays or wipes. And final question here, who is at higher risk for getting coronavirus? Well, Dr. Serino says that most cases tend to be mild, but for those with underlying health issues, things like chronic illnesses, if you're immunocompromised, and even older adults, those folks might be at higher risk of more severe illness.
For the most part, people who don't have any other health problems are probably going to recover this just like having a common cold.
And we are working hard to get you information about the coronavirus. We're trying to squash misinformation. And Dr. Serino has told us this is not a time to panic. It is, though, a time to pay attention and stay informed. We're helping you do that. And you can text us at 503-226-5111 with your questions. Just text FACTS to 503-226-5111. Back to you.